Hey, my name is Brandon Maddox. I'm your therapist today. I'm going to be working with you. Can I just get you to confirm your name and date of birth for me?
Yes, it's Alex Hauser. It's 22597.
Okay, Alex, and what are we seeing you for today?
I'm having some shoulder pain.
Okay, left or right?
It's my right arm.
Okay, and can you describe that pain for me?
Yeah, it's kind of like a sharp pain right here in the front of my shoulder.
Okay, and are you having pain at the moment?
Not right now. I really just have pain when I'm like moving or
Yeah.
after work or after using it a lot.
Okay, and work, what do you do?
I work as a physical therapy technician.
Oh, very cool.
Yes.
And what kind of setting do you work in?
I work in the hospital, so
Okay.
I do a lot of like assisting, doing patient transfers.
Yeah.
So I definitely use that shoulder a lot.
Okay, and does that seem to get in the way with your work?
Yeah, a little bit.
Okay. So you said it's a sharp pain. If you had to give it a number 0 through 10, 0 obviously being none, 10 being like an emergency, what would you say it gets to at the worst?
I would say probably a 6.
Okay. And what makes it better?
Honestly, just resting it
Okay.
in ice sometimes.
All right. And what else do you like to do outside of work?
I do a lot of like weightlifting and I like to play tennis too, and that obviously aggravates it as well.
Yeah. Have you been able to participate in those things?
Very little.
Okay.
But if it's not hurting as bad, I'll try to.
Okay. Now, when did the pain start?
Probably about a month ago I noticed it.
Okay. And when you play tennis or lift and you feel it, how long does it take until it goes away after you stop?
I would say it probably goes on for about an hour after doing activities with it.
Okay. All right. And what movements really bother it the most? Do you have any idea?
Really just when I like raise my arm up, it hurts really
Yeah.
bad.
Okay.
Or when I'm playing tennis and I do that motion, it hurts too.
Okay. All right. So I just want to observe you a little bit, if you don't mind.
Okay.
So I'll have you stand up for me, and I'm just gonna have you relax for a second. I just want to take a look at your posture. Just okay. Now turn to the side. Good. Yep, like that. All right. Your shoulders are a little bit rounded. Turn to the other side so I can see your left shoulder. Okay, so they're about equally rounded, which is pretty common. And then turn around so I can see the back. I want to just take a look at your shoulder blades. And your left shoulder sits a little bit higher. Are you left or right-handed?
I'm right-handed.
You're right-handed? Okay. That's typically, this one will be a little bit lower, so that's normal.
Okay.
I'm just going to feel your shoulder blades if that's okay.
Yes.
And they seem even. The right one is actually a little bit further forward. So while you're there, I'm going to have you lift your arms out to your side like you're doing a snow angel or a jumping jack.
Okay.
Let's go ahead. Good. Back down. Any pain there?
Just a little bit.
Okay. Let's go straight in front of you with your arms straight in front of you. Yep, like that. Good. And back down. Okay. I felt a pop there. Was that painful?
A little bit.
Okay. All right. Give yourself a hug. All right. Now come back and pinch your shoulder blades together. So let go and squeeze your shoulder blades together. Okay. Any pain with any of that?
Yeah, that hurts a little.
Okay. All righty. So let's have a seat on the table again. All right. I want you to have your arms like this, elbows bent at 90, just by your sides. Don't let me push your hands in towards you, okay?
Okay.
Hold, hold. Any pain?
Yeah, a little bit.
Okay. I'm gonna go the opposite way. Don't let me push you away. Okay, ready? Hold, hold. Pain there?
Yes.
Okay.
Yeah.
All right. And then let's see. All right, I'm gonna put you in this position here. I want you to hold it.
Okay.
All right, can you hold it like that? Is that uncomfortable just being in that position?
A little bit, but
Okay.
not too bad.
All right, so let me push your arm down, okay?
Okay.
Hold. Did that hurt?
Yeah.
You can relax. Okay. let's see. Let's go as high as you can.
With just this arm?
Yeah, just go as high as you
Okay.
can. You alright?
Kind of hurts right there.
Okay. I'm gonna add a little bit. Is that okay? Let's relax. That was painful?
Yeah.
Alright. In fact, here, I'm gonna have you right here.
Okay.
Alright? Let me get back in. I'm gonna have you right here, and I want you to slowly lower your arm. Okay? Don't
Okay.
touch my hand though, so go and lower. Keep going. You can lower, you can go a little bit faster. There you go. And relax. How did that feel?
A little painful.
Okay, so the first two tests I did were testing for what's called impingement.
Okay.
All right. There's a ball at the end of your arm bone, and there's a roof above it,
Okay.
and there's structures that pass through that area, and sometimes they can get compressed when you lift your arm above your head. That's called impingement.
Okay.
And since that hurt, I'm thinking that could be that direction that we're headed in.
Okay.
The one I just did was testing your rotator cuff, and it seems like that is intact.
Yeah.
Let me think. Let's go ahead and let's do one more test. I'll have you
Okay.
stand back up.
Okay.
I'm gonna have you, with your arm by your side, just lift it away from me a little bit, just a little bit. All right, don't let me push your arm in, okay? Hold, hold, hold. All right, relax. All right, so you're nice and strong there. Let's go ahead and lay on the table, if you don't mind. Let's see if it's your right shoulder. Your right shoulder, so yeah, head down that way. Okay. And I meant to ask you earlier, do you have any history of neck pain or anything like that?
No, not really.
Okay. I just want to, before I forget, I want to rule out to see if it's coming from your neck.
Okay.
Sometimes a shoulder problem can manifest itself as a neck problem.
Okay.
Did I say that right? Wait, hold on. If you have a neck problem, sometimes it can look like a shoulder problem because of the nerves.
That makes sense.
All right, yeah. So I'm actually gonna have you sit back up real quick. I know I'm being a pain in the butt.
That's
so-
okay. No worries.
All right, so I'm just gonna have you move around a little bit.
Okay.
So just look up as high as you can, all the way up. Can you go further? Good. Now tuck your chin in. Good. Now look at me. Don't move this part of your neck. Just try to tuck your chin in like that.
I'm
Chin,
sorry.
No, you're fine. Try to touch your chin to your throat. Any pain there?
No, just a lot of double chins.
That's all right. All right. I'm gonna have you rotate as far as you can that way. Just your head. Okay, good. Other way. Any issues so far?
No.
Okay, everything looks good. Let's go ear to shoulder. Good. Relax your shoulder. You're
Sorry.
good. Back up. Just move your head, ear to the other shoulder. Good. Now look like you're looking in a blind spot behind you to the right. Like that. Good. And then opposite side. Look up a little bit more when you do it. Any pain there?
No.
Okay, good. Now I'm gonna have you lay back down.
Okay.
So I don't think it's from your neck. But we always just want to make sure. Right. So I'm gonna take your arm if you don't mind, and I'm gonna kind of take you through a few motions
Okay.
and see how that feels, and I want to get some measurements. All right.
Okay.
All right. So if you just relax. Does that feel okay there?
Yeah, it's okay.
All right. Just giving you some gentle distraction.
Thanks.
You're welcome. All right. So I want you on your own. I'm gonna let go. I want you on your own to go up as high as you can, like a snow angel,
Okay.
and you can do it just on that one side, high as you can.
It's hurting right there.
It hurts right there.
Yeah.
Okay. You can come back down. All right. So you relax. I'm gonna try to take you through that motion there. I'm just gonna grab your shoulder blade. Tell me when it starts to hurt.
Okay.
There.
Yeah.
Okay. I'm gonna see if I can go a little bit further.
Okay.
You're not making a crazy face or anything, so.
Okay.
Okay. I'm just gonna get a measurement real quick. Hang in there. You doing okay?
Yeah.
Okay. 135. 5, that was with the GH. And so now I'm gonna take you through that motion again, but I'm gonna let your shoulder blade move with you too. Okay?
Okay.
You okay?
Yes.
I know that's probably not the most comfortable.
That's okay.
$162. Okay. Now let's go overhead.
Okay.
I just want you to do it. I'm gonna see what it looks like. So straight back, as far as you can go. Does that feel okay?
It kind of hurts right here.
Okay. Is that the extent of your motion there?
I think so.
Okay. You can come back down. All right, now I'm gonna do it for you. Just relax. Relax, shake that out a little bit. You doing okay? You're doing good.
Yeah.
All right, I'm gonna take another measurement. Just let it go as far as it wants. And that looks pretty good. $173. Good. All right. Now I just want to see what it looks like on the other side. I don't have to, if it looks the same, I'm not going to measure it. Can you just go do this motion? Snow angel motion. Good. Back down. All the way up. Good. And do you have any issues with that shoulder?
No, that one's fine.
Okay, good. Alright, I'm going to make some room here.
Okay.
In fact, you know what? Can I have you flip to this side?
Yeah.
Whoop. There we go. Alright. Thank you. You can go ahead and lay down. Alright. Scoot towards me just a bit. Please.
Yes, sir.
Alright. So I'm gonna see how your joints move. Okay. I just wanna see if you have mobility, so I'm just gonna kind of press on that joint a little bit, kind of
Okay.
wiggle around that, what's called the humeral head,
Okay.
and see if there's available motion in the joint.
Okay.
So, just relax. Joint line. Okay. That moves pretty good. Let's see if it moves downwards. So the biggest thing with impingement is your shoulder can't move down. It rides up, right? And so that's what allows it to get compressed by all those structures.
Okay.
You know. You okay?
Yeah.
Any pain there?
A little bit.
Okay, so it seemed a little restricted going this way. Going back towards the back, called posterior, it was fine. Going down is a little restricted. I'm gonna check your left side to see if there's something similar.
Okay.
All right, just relax. Moves good. Okay, so it seems like this one, the joint moves a little bit better.
Okay.
I mean, as a whole, you move fine, but that joint might be a little restricted on that right side.
Mhm.
And I think that we can do things in therapy that will improve that. And in turn, that will make moving overhead easier, since you do like to lift, you do like to play tennis, so you kind of live up here.
Yeah.
Plus, I've been through it too. I know what it's like having to carry patients around at the hospital. It's not the easiest on you. So we got to make sure we get your shoulder feeling better. It's just a little irritated right now.
For sure.
But everything, nothing looked too concerning to me, and I think that with a couple of weeks of PT that you'll be good to go.
Okay.
Yeah.
Awesome. Thank you so much.
Yeah, you're welcome.